my water just broke. I felt like things really intensified.
She was right there and she was coming.
It was an amazing feeling.
I'm going to cry just thinking about it. I could feel her head.
We heard her cry. We were squeezing hands and she was screaming.
I'm Bryn Hunt Palmer, and you're listening to The Birth Hour. This podcast is designed as a safe place to come together and share childbirth stories. Stick around and join us to hear informative and empowering birth journeys from all over the world. This episode is in partnership with Motif Medical. Motif designs insurance-eligible products for busy moms. With a focus on innovation and empowerment, Motif's line of breast pumps and maternity compression garments are sophisticated yet discreet and made to support mothers as they navigate new motherhood. Discover why moms are reporting more milk in less time with the Luna breast pump and see how you can get it covered through insurance at motifmedical.com/birthhour. You'll also see their other products there like the Oreck Glow, which is their new wearable pump that I discussed at the end of this episode with lactation consultant Jackie. We talk about what makes this wearable unique and how it compares to the Luna, and it's really just a great conversation, so be sure to listen to that at the end of this episode. Before we get to today's birth story, I want to talk a little bit about our online childbirth course. It's called Know Your Options, and this is the course you've been looking for if you just have that gut feeling that you know you should be taking a childbirth course, but maybe the one that's being offered to you by your care provider is not exactly what you're looking for. It might be more catered towards the type of birth they want you to have versus making you informed of all your different options and how to address different things that happen in birth, because as this podcast has shown us, birth is very unpredictable. So we would love to have you check out our 12-module course. You can go to thebirthhour.com/course to see detailed outlines of what is included in the course. You will also get a bonus course called Beyond the First Latch that is an additional 6 modules all about pumping, feeding your baby, going back to paid work if that's part of your plan. And we have a special coupon code for you. It's 100OFF for $100 off enrollment. Again, that's thebirthhour.com/course. Another great way to support the Birth Hour and get more involved in the community is to join our Patreon. You can do this by going to patreon.com/birthhour, and you pledge $5 or more a month, and you get perks like access to our archived episodes. We have over 800 episodes in the archives now that are not available in the main podcast feed. You also get access to our private Facebook group, which is a great place to find support and community, as well as searching the archives there. There's been so many great discussions, and you can just pop a question into the search bar and you'll find some great answers to things that have already been asked. The last thing that we offer to our Patreon members is monthly Zoom calls, which is a really great intimate way to connect with other Birth Hour listeners and me each month. Your support means so much to me. There's a few different ways to do it. You can do a gift membership, send that link to someone who needs a gift idea for you, or you can do an annual membership, which basically gets you like 2 months free. This support means so much to me and really, truly keeps the lights on here at the Birth Hour, because with more podcast networks emerging, it's becoming a little more challenging as an independent podcaster to keep things going. So our Patreon supporters are a huge part of that, and I'm really grateful to each and every one of you. So again, you can go to patreon.com/birthhour to get started with that. Today's guest is Sarah, and she has 3 birth stories to share. She had 3 cesareans, starting with the first one being during COVID. She also talks about her 3rd pregnancy of 4 pregnancies. She had a termination due to genetic abnormalities, so we hear that aspect of her story as well. Sarah is also a reproductive psychiatrist, and she talks about her own struggles with mental health during pregnancy and postpartum, and how all of that has come full circle with her work she does today. All right, let's hear from Sarah. Hi, Sarah. Welcome to the Birth Hour. Thanks for coming on the podcast.
I'm so excited to be here.
Awesome. I know we have several stories to get to, but before we do that, can you tell listeners a little bit about you and your family?
Absolutely. I'm Dr. Sarah Oreck. I'm a mother of 3. I'm also, very importantly, a reproductive psychiatrist, and I actually was working with women in the transition to motherhood way before I ever decided to become a mother. So it's been an interesting transition, knowing what I know, and then sort of being put in that spotlight of my own transition to motherhood. And I want to say it made it easier, but in some ways, I think it may have made it harder. That's sort of the specialty I have. I also am the co-founder and CEO of Mavita Health, which is a virtual platform that does wraparound mental health care, including prescribing, individual group therapy, couples therapy, all for women on this journey.
Very cool. Yeah, I'm excited to hear how everything ties into your story and your work. So let's go ahead and start with your first pregnancy and birth, wherever you want to start there.
Yeah, so I decided to become pregnant a little bit of like in the last part of 2019. We were trying for a couple of months. And this is such a common story, but like many women who had been very good at not getting pregnant and of using birth control, I started to feel that impatience around, God, it's just not happening. And facing that, I think, was really challenging because it's something I heard so much from my patients. And I always thought, well, if you're under 40 or under 35, you can wait a year or even longer until you have to go and get more workup for infertility. And yet even waiting 3 or 4 months felt like an eternity. So I've definitely been there. We finally became pregnant, and I had really terrible morning sickness, but really all day long. I think the hyperemesis of it all is something that's underestimated. I think its connection to depression and anxiety is much higher than people suspect. And the way that it takes you out of your daily functioning, I think, is so significant. But I think for a lot of people and a lot of women, it's sort of a rite of passage and something that's not discussed enough. And so that was all in the background. And then March 2020 hit.
Yeah.
And I was in my first trimester. And our lives entirely changed with COVID-19. And I think it was a really big challenge, as many people who have been pregnant during the pandemic can attest to, of just going indoors, but also just not being, you're then in charge of your health, but also the health of this baby. And as a first-time pregnant person who knows a lot about how things can go wrong as a doctor, and with an anxious baseline, which I frankly have always had, I think the combination of the two was particularly challenging in terms of my mental health.
Yeah, I can imagine. There were so many unknowns that it was really hard, obviously, for everyone, but I really felt for everyone in our community that was pregnant at that time.
Yeah, there was I think it kind of raised the bar on, okay, well, now I definitely have to clean every single grocery and wash every apple that comes into my home. Mm-hmm. I felt like I sort of forced my family into hunkering down more than maybe we would have. And just the level of uncertainty which already exists in a pregnancy, and then kind of to have an event like that, I think was really a huge challenge. But, it continues to happen, though we don't have another pandemic. I feel similarly for women in terms of how they have, see the outlook in terms of American politics, or, mothers in Minneapolis and St. Paul today. Just really a lot of challenges there.
Yeah, definitely. I feel like our nervous systems were not meant to handle all of this in so many different unprecedented times in such a short period. It's just been so hard for so many, and definitely on the mothers. So was there anything that helped you through that time?
Yeah, I think, my own treatment. And frankly, I had always been in therapy, just as someone who's a mental health provider. That's always been a sacred space for me over a decade at that point. And I think it was what I needed to get through that time. And community in the ways that I could find it, whether it was online, meeting with other mothers that were going through this transition. I was part of a group formed by a doula that I thought was really helpful. Though, in some ways, I think some of the fears also made me make decisions about my pregnancy, which were potentially controversial. I did opt for a C-section. though my baby was not breech, because I was so fearful of having to go into the hospital with false labor or just the uncertainty and unknowns of a vaginal delivery. And I don't know if I had ever imagined that I would do that, but it felt necessary at the time with my level of anxiety. I'm also someone who's, attended a C-section. I've seen and been in the room for lots of them in medical school. It wasn't something that I was so afraid of. Of course, it's, there aren't many surgeries where you're awake. So it's definitely can be quite frightening. But I thought that that's what felt right for my body, for my pregnancy, for my birth. And I think it's something that inadvertently, sometimes I hold a great deal of guilt and shame about.
Okay, well, let's talk about how that birth went.
It's actually fabulous.
Okay.
It was exactly what my husband and I needed. I think a lot of the data and I think a lot of the information with a planned C-section and emergency C-section is sometimes sort of put together, but the two can be very, very different experiences.
Yeah.
I got to choose music. I got to talk to my doctor. He was talking me through everything that was happening. I was considering actually having one of those clear drapes and peeking in there and seeing everything. I decided not to, that maybe it was a little bit too much. But, I heard his voice the entire time, and it's an OBGYN that I actually had since I was in my late teens, early 20s. So I had known him for a very, very long time, trusted colleague. And I would say it was a very peaceful and harmonious C-section. Before that, had done a lot of breath work, and the breath work itself had something that really got me through the pain, the anxiety, and it was, a quick 30 minutes and I got to meet my baby.
Yeah, it's definitely a whole different ballgame with a planned cesarean. We talk about that in our childbirth course. It's like a whole separate module because you really can't compare the two.
Right. And I think there's things you lose and you don't experience that I would have in a vaginal delivery. So there's certainly some grief around that. But I think given the context, my level of anxiety, and to just paint the picture, it was a time when I didn't know if going into a healthcare facility was going to increase my odds of getting COVID significantly. I think that's where we were at. There was no vaccines. Mm-hmm. People were being separated from their babies for an extended amount of time if they did have COVID. Sometimes partners couldn't come in the room, especially if anyone was positive. I had to get a test even before I was able to go into my delivery for them to decide, which room or which part of the ward I could be in, right? Whether it's COVID positive or not. So really, I think in some ways, this kind of controlled setting where I was able to know exactly how long I would stay, what was going to happen, was really helpful to me. And I just want to say there are increased risks with any cesarean section. And I think it's really important for women when they make a decision like this to be fully on board and understanding of those risks. But ultimately, I also had a really adherent placenta. And so my doctor said, if we had to deliver this, I don't know, you would have had, I don't know what would have happened. This would have been a really challenging delivery of the placenta in particular. But I think ultimately, just like we talk about bodily autonomy in a lot of other ways, including terminations, we need to talk about bodily autonomy when it comes to all these procedures. And ultimately, that's what I'm really passionate about. But, it's not without judgment. The nurse my intake nurse at the hospital that day asked me if I just didn't want to push and I just wanted the easy way out. And, it's incredible to me that this day and age, someone would say that to a patient where they have absolutely no context of what's going on. But ultimately, I think it's important for staff, for people to sort of be clear about that. Birthing decisions come with a lot of context, and you might be meeting someone and you don't absolutely know it. Also, that there's no right or wrong way. I think we need to question that paradigm a little bit.
Yeah, I agree. I think that it can be really hard to get kind of wrapped up in all of those things, especially with all of the social media around birth now, which is great that we're showing more of birth, but it comes with some mixed bag as far as how you take those messages that you're seeing and being surrounded by on all the platforms. All right, so let's go ahead and talk about postpartum. That was still COVID times. So what did that look like for you?
In the thick of COVID, that one was okay. It actually, and I think a lot of people say this, it was quite nice to have the excuse of COVID to be able to really nest, to not have sort of the influence of, oh, do you want to meet my baby and who needs to meet and when they do, and just to be able to be cozy. I would have been someone regardless of COVID because of the vaccination schedule that would want a little time with my baby. And so I think it gave people the excuse to be able to sort of protect their infant and have that really cozy time with their baby. And I think that was really helpful. But I think the anxieties only grew now that the baby was outside and would have to fight off COVID if they got it, for example.
Yeah. Yeah, we hear that a lot about the kind of silver lining of COVID with not feeling all the obligations that we feel in our culture and work and everything. So
that's absolutely right. My work had then become, I had done a lot of virtual work with my patients just because pregnancy, postpartum, childcare becomes really difficult. And I live in Los Angeles, and though I had an office, even the traffic sometimes would make it so people would prefer to use virtual and Zoom, for example. But my work had at that point converted to all at home. So in some ways, I think it really was lovely for nesting. But what I realized later is that it probably, I lost a lot of the support, especially from peers, from seeing other babies, from connecting, from not feeling so alone in this transformation to motherhood. So again, very much a double-edged sword.
Yeah, that makes sense. All right, so let's talk about your transition to deciding to have another baby, where that decision worked out for y'all.
Yeah. So for us, it happened really quickly. It happened 4 months postpartum. So again, in the thick of COVID.
Yeah.
And we had another baby. We're not that young. And we thought, let's be open to this. And unlike the first time, I thought, hey, this took a while. It took us about 6 months to get pregnant with our first. Why wait? It's probably going to take another 6 months, if not longer. But boy, was I wrong. And we were pregnant then in late 2020 and still no vaccine. But I think by the time that we were further along in the pregnancy, we did have vaccines and things were starting to change a little bit. Though I have to say, we were in lockdown for a couple of years. So we kind of took it to the next level, especially with the babies at home. But again, I think what's nice about it, which is very different from my third, who I had in 2024, that it felt like a little bubble that I haven't had again. With what you said earlier, there weren't as many demands.
Yeah.
Whether it's from community, whether it's from just work and other social demands, they just weren't there. And I do miss that, though I don't miss washing groceries.
Yeah. All right. So what type of birth did you plan for this time?
So because I had a C-section before, we just did another C-section. And similar to this one, it was similar to my first. It was a very serene is the word that I would say. And I think it's nice to sort of hear that perspective, because often we just hear about cesarean sections as being sort of the worst option or chaotic. But I do think that there is a possibility to have this serene experience. My breath work was really essential to me in kind of managing my anxiety, because I'm not going to, sugarcoat it. It is anxiety provoking. Mm-hmm. It's almost the response to the nurse when she said, oh, you just want the easy way out. The truth is there's no easy way out. Cesarean sections are not easier than vaginal deliveries.
Yeah.
they're just different. But similarly, I got to be with my baby very early on. We were very privileged to not have any sort of NICU issues. Babies were able to come to me, though I think there is a little bit of an issue, which is always hard as someone who's gone through something medically, even a vaginal delivery, to have your baby sort of worked on for a little longer, to hear the back and forth of the pediatricians when it's not super clear to you what's actually being said. I do remember a moment of panic. I think there was a little bit of stuff in his lungs. They had to use suction. And again, this is a little bit of this is what you get with a cesarean section, right? Sometimes babies don't have as much kind of squeezed out of their lungs as they do through the vaginal canal. That was all sort of known to me, but we did kind of get into that. And it felt like 30 minutes, but I'm sure it was 2 minutes. But things that kind of escalated do feel like they take longer. And I think it was a little bit of an insight into what I hear a lot in my practice of the lack of communication sometimes, or the perceived lack of communication with the birthing person and their partner, where something is happening. But of course, the physicians are used to they need to act. But sometimes here's what's happening and here's what we're doing falls off.
Yeah.
And how difficult those experiences can be, how long it can seem, even in cases of hemorrhage, of sometimes the patient isn't really communicated with because, again, the team is trying to act. But that's something and somewhere I think our medical system could really use some improvement.
Yeah, I think it helps too. Well, there's a few things you can ask for the notes from your birth, or if you have someone filming it. I know for me, my third baby came out not breathing and it felt like forever. And it was, I look at the video and it was 34 seconds,
I know.
But yeah, it feels way longer. There's no sense of time really in birth.
There's no sense of time. And I wish there was a little bit more holding, but I understand that that's not something that's necessarily taught so well in medical school.
Yeah. All right. So how was postpartum this time?
I think this one was even harder, having 2 babies and the world kind of being half in, half out.
Yeah.
There was a pressure then to start to socialize. I knew that I had been suffering. We are social creatures. And though the nesting was kind of fun, we had my mother moved in with us. So we became a multi-generational family after my first baby, and she was helping us. But I think I started to really realize the ways that we had suffered in terms of friendships, in terms of connection. I think in some ways it was an alarm bell to me of what we're seeing, even technology, and how technology has isolated us from other human beings. And it was a time where I was sort of pushed to kind of see more people. I think I was vaccinated by then, so it felt a little bit more comfortable, but I don't know if you remember the are you vaccinated? Are you not? What's going on? And of course, there was so much misinformation and a lot of I live in Los Angeles, and I lived in the west side of Los Angeles, where there's a lot of wellness influencers and vaccine hesitancy, frankly. So then it felt like a battle between, can I go out and trust my neighbors? My babies can't wear masks. So here I am kind of stuck between these 2 worlds of wanting to go out and then starting to kind of, I have to be honest, a paranoia around other people's vaccine status.
Yeah.
And how harmful that is to intimacy. And I remember going to a mom group, and even I remember the person that put the mom group on, I remember sidebarring with her, being hey, is everyone vaccinated? How do we know? And just how challenging that was for me as being someone who did feel more comfortable on the side of vaccination. I remember there was a delay between adult vaccination and child vaccination. So then that also sort of brought an element of uncertainty. So I think there my anxiety actually started to escalate quite a bit because I had to face uncertainty because I knew that the connection, that socializing was going to be so important to my well-being. But I was also like really afraid of COVID, particularly that my children would get COVID. So in that battle, there's the first time where I said, I love my therapist, but I want someone specialized in this area, specialized in perinatal mental health, who kind of can understand this particular kind of framework a little bit better than what my general therapist had helped me with. And she was incredibly helpful. She was also in New York. I was in Los Angeles by that time. So I did have to also find someone who was more local just because of licensing issues. So that's when I went on a hunt for someone like me, basically, who would be my counterpart and would be able to help me. And I honestly had such a hard time finding someone. Even as a reproductive psychiatrist, as someone who's known in the field, who has colleagues, it was really, really hard to get in with someone. Mm-hmm. And I had to sort of use all my weight of, hey, I've heard great things. Can you please see me? I'm desperate. But the wait times were, super long, even for people who were cash based, like only accepting cash, which is out of network. That's something that's very common in the mental health world. And that's when this idea really settled for me of like, I have so much privilege here and I can't find someone who I want to really be the person to help me through this time. Imagine what it's like for everyone else, for people who need to use their insurance. And that's when the idea for Mavita Health really became, I had the idea for a long time, but I think that's when it was really galvanized that I had to do this, not just, for myself, but for all of the people who needed this type of support. And so I really had significant postpartum anxiety, a lot of intrusive thoughts, particularly health anxiety, and certainly the backdrop of COVID-19 didn't help. But I'm sure that I would have been someone who dealt with these issues regardless. I think COVID-19 just heightened it.
Yeah. So did you start that right away, or was that something that happened down the road?
It was a delay, but I ultimately found someone and I was able to get in with someone who was specialized as a perinatal mental health specialist. And that was incredibly helpful to me. And we had always thought about wanting 3 babies. And I think that allowed me, eventually, when we waited a little bit longer this time between our kids. But I think it was that treatment that really allowed me to open the door for this possibility, because I think without it, and I see those cases where people may want to grow their families, but because of crippling mental health issues, it may stop them from doing so. And after the second, I felt the uncertainty that how much had happened. I couldn't imagine doing it again. And I actually went on to have another pregnancy with a loss in the second trimester, and then had my final 3rd baby. It was my 4th pregnancy. And I think without the care that I was getting, I would have never gone on. Maybe I would have had my 3rd pregnancy and the loss, but I don't think I would have tried again.
Yeah. Pregnancy after loss is a whole other
ballgame.
Bag of anxiety. Yeah. It's so hard. What do you want to share about your 3rd and then 4th pregnancies and births?
Yeah, I think the 3rd, again, what I would say is, and this is ultimately where therapy, I think, is so meaningful, of it allowed me to be able to make decisions not based on fear or the things that had been really difficult, but really based on my values and what my family and I really wanted. And that was to expand our family. I'm an only child, so this is a very, I think, unknown for me to have 3 children. And it was so funny. My mother, who's a mother of an only child, just couldn't understand the concept. I think she still has difficulty understanding it. But the therapy, I think, ultimately, and I think this is what people think of therapy as helping them. Obviously, when they're in crisis, it can be incredibly helpful. But ultimately, what I really think, and this is what we do at Mavita Health, is allowing you to make decisions based on values instead of, right, the other things that can sometimes drive decision making. So ultimately, therapy had really, really helped me. At that point, I was toying with medications, but I had been on medications in the past in my life, sometimes have some side effects to them, particularly SSRIs. So I held off, ultimately went on medications after the loss, but was held off, and actually psychotherapy twice a week was what I needed. And had my third, we ended up getting an NIPT test, and it kind of had some flags. And people forget that this is a screening test, that's actually not diagnostic. This is the one that people love because it tells them the sex of the baby very early on. It's also testing for some duplications and sort of genetic abnormalities. And ultimately, it is a screening test. So our screen wasn't great. It said that there was some risk. So we ended up doing what's called a CVS, chorionic villi sampling. And I think what's challenging about that and the amniocentesis is that those are diagnostic tests, but because people are relying on screening tests, I think practitioners aren't as good or as efficient at doing these tests anymore. That's like a whole other conversation around sometimes we get comfortable with screening tests and forget the importance of a diagnostic test. Ultimately, we got a CVS that did tell us that there is a severe genetic abnormality that was global. It would mean if the pregnancy was able to continue, that the life of this baby would be basically in a medical context, so that they would need a lot of medical support to survive, would have a very short lifespan. And it was the most devastating news I think I've ever received. And because these tests take so long, because we don't do them generally, I was waiting for about, I think, like 4 or 5 weeks.
Oh my gosh.
From the time I knew something was going on to the final result, which was just heart-wrenching. Mm-hmm. And that was about, it was like around Thanksgiving. I remember that being a really hard holiday to sort of get through. Ultimately, I live in California. My husband and I had always talked about what would happen if we ever got this type of result. And we were really aligned that it wasn't right for our family, though, you know, I fully respect families that decide that they want to sort of take this type of experience on, and it can be incredibly valuable and meaningful. But with 2 older children, it just didn't feel right for our family. And I feel privileged to live in California, where that was an option, to terminate based on really severe global genetic abnormalities that I thought, you know, because I'm someone who believes in a quality of life versus just a life, I felt like the quality of life for that child was not one that I would choose, and I was able to. So we had the termination, which I just, I think for anyone who thinks a termination is easy or flippant, it never is, even if it's very early on. Mm-hmm. I have worked with, I think thousands of women at this point who have made these decisions for a variety of different reasons. They're never easy. It never goes away. It's always something that's in your mind. I'm 100% confident that we made the right decision, but it is something, and, I think about this baby quite a bit. Mm. And I think in that grief, therapy didn't hold me enough. I really needed more support. And that's when I got back on an SSRI, which I hadn't been on for many, many years. But I believe that you've got to use every tool that's at your disposal. And that was the tool that, I needed at the time.
Yeah. So I'm assuming you stayed in therapy as well. And
Yes. I mean, I think I'll stay in therapy probably forever.
Yeah.
But that's not what therapy has to be for people. Like, I do
Yeah.
believe that therapy can be something that holds you during crisis, helps you realign to your values, and then you can take a break. I happen to be in a career where I think I need that space because I hold so much of people's experiences, of people's trauma, frankly. And I think it's important for me to have that outlet.
Yeah. So you mentioned that without those tools, you probably wouldn't have gone on to have a fourth pregnancy.
No, absolutely not.
What got you to that point?
Yeah, after you have this type of loss or grief, everything went wrong that could have in some ways in this pregnancy for me. And so, in addition, I had a bunch of bleeding initially, we weren't sure if it was I had to take progesterone. It was it started to be very, very complicated. And I think it would have been so easy to just be driven by the fear of hey, this is never going to happen again. Also, there was an element of my 16-week termination that felt clandestine, that it had to be in this, unmarked clinic. The woman that did it, who's a true hero, goes around the country and does these, but, she's someone whose life is threatened.
Yeah.
To choose that life is one of taking a risk, but also knowing that it's incredibly important for people to have this choice. And some of the things that are happening in other states are truly barbaric, where the pregnancy won't go on for anything. It'll just be suffering and potentially life risking, for the birthing person. But I think after that, to be able to have therapy and support, again, to really be able to integrate the loss, the grief, the fears versus the values, the goals, the what I really wanted for my pregnancy. And again, in my attempts to control, I actually chose IVF as a way to kind of, do the PGT testing to be able to make sure that things wouldn't go this way again. And that's the decision that we made. And I think it was the right one, but again, still really challenging. I think there's this idea, just I guess how my C-section went, that somehow IVF is where you have ultimate control. But I think anyone that's done any kind of assisted reproductive technology or IVF knows that it's like the veneer of control, but ultimately you may not have any eggs that mature. That happened to us during a cycle. And you may not get what you want. It may not happen. But I think the support, the therapy, and actually for the first time with that loss, my co-founder of Mavita Health, actually, she's not a physician, but her way into mental health and getting mental health herself was having a 20-week loss. And she was actually the biggest help to me during that time, to find someone who had gone through a similar experience many years ago and was able to come out the other side, was able to have 2 kids subsequent to that. I thought that was one of the best anchors for me. So the experience, the peer support, really.
Yes. I always recommend a pregnancy after loss group too, because it's just such a different experience.
Listen, not every loss is the same. And I think people get really hung up on that. They're like, well, I had a 20-week loss and the people in the group had 6-week losses. Yes. And people, I think, have an experience of grief that it may be different from yours, and no one's going to have the same experience, but at least to be able to kind of share, to have the space to be held is really important. It's not about having a completely mirrored experience, which I think is often what people are starving for, but it's just about the similarities or the differences and just the space. Also, if you're someone who's supporting another person who's had an experience, make sure to kind of listen and hold versus, oh, here's what happened to me, right? We have the kind of that desire to share our experience. But I think it's about, and this is what my co-founder, now she's one of my best friends, did for me, is I think she just was I hear you, and I knew inherently she gets it. And it was only only gave me details about her own experience once I started asking questions. I don't know if she did that consciously, but I thought that was incredibly helpful.
Yeah. All right. Well, let's go ahead and get to your fourth pregnancy and birth story.
I know the fourth pregnancy was really when I realized, and again, I've always known this sort of logically, but the question we often ask in our culture when we see someone doesn't have a baby, for example, or a child, and you say, oh, is this your first pregnancy? And how it could be someone's eighth pregnancy. And yet we're so unaware of that, or someone sees that you have one child. And so they ask, oh, is this your second? You may have lost an infant. You may have lost another child. And just sort of the sensitivity around that became so real. Oh, is this your first? But I would get a lot, is this your third? And this, the weight of, I certainly don't want to erase my third baby. She's a part of our family. But choosing the right partners, right? It's if someone just asking you at the grocery store, maybe you just move on and say yes, no big deal. But if it's someone who's meaningful in your life, or someone who, is a friend, maybe it is sort of a space to start to talk a little bit about that. And I really gave myself permission in these interactions where it mattered to me to say, actually, it's not. It's my fourth pregnancy. Right? But it'll be my third child. So I think that's really, sometimes the response would be
right.
It catches people off guard, but I think it's something that I felt was really important to start to have that awareness around how complex these issues can be. And really hard, still a decision I have to make when I think about, how many kids do I have, or how many pregnancies. But ultimately the pregnancy, because I had so many resources in terms of my mental health, felt a little bit more stable. I think after loss, every ultrasound finding that isn't ideal gives you a little bit of a startle. And I certainly experienced that. And ultimately, though, I think my first two and the third pregnancy were really helpful in kind of getting through it and knowing it might be a loss and I've survived it. I'll be okay. It'll be hard. It's going to, be a part of who I am, but we'll get through this. And very similar pregnancy. I was very C-section again, really lucky, though actually had maybe thought in my mind, what about a VBAC? But decided that kind of excitement was not for me. And my OB was actually thrilled because my uterus was not doing well. The scar wasn't great, to the point where I really cannot carry any other pregnancy. Not that 3 is far too many children for me anyway, but it was good to sort of feel like I made the right decision and just continuing on with the C-section, similar experience. But very different postpartum. The world was open and I got to enjoy some of that. And I got to introduce my baby to my extended family and my friends. And the joy of that really outweighs all of the health anxiety I think that I had. And certainly some of the health anxiety persisted, but I think ultimately the connection with other human beings, to have more of a village around you. My aunt was more of a part of our postpartum experience. She helped me as a night nurse. Just a lot more people in the house, I think, was just, life-changing and a really nice sort of conclusion to building my family.
Did you feel like the postpartum experience was much different as far as your mental health?
Oh, yeah. I think being able to walk outside, to go, and it seemed so... listen, and we did go outside, but I remember after my first kind of again, this might be escalated. I would move to the other sidewalk or across the street when I saw someone coming towards us.
Yeah.
That level of hypervigilance, your brain already changes during pregnancy. Your amygdala gets larger because you have to be more hypervigilant to your baby's cues. And increasing that to that level, I think was really detrimental for me. And so having this postpartum where it was just like, yeah, I get to go to the grocery store, I get to interact with people, and it's okay. I have my baby in a cute carrier and we're out. Even like the clothing, I mean, it's a girl, so I got to experience that for the first time. I have 2 boys. But I think there was just something about the more public facing that was really, I mean, I traveled with her sooner. It just felt kind of liberating from what I had chosen during the pandemic.
Yeah. Yeah. I bet that was a very different experience, especially having the 2 so close together during the pandemic and all the things that come with that.
Yeah. I almost say like our pandemic, it got extended because I used the second baby as an excuse of like, oh no, people are going out. We can't do that.
Yeah.
We have a baby.
Yeah.
And I'm so glad that I have had this experience afterwards because it felt really corrective, frankly, for a lot of different reasons. But it felt like, oh, this is what it's supposed to be like. Your friends are supposed to meet your baby and lavish you with postpartum prizes and visits. Mm-hmm. And to not have that was just really, really difficult.
Yeah. I feel like too, for me, my first 2 were close together. And then with my third postpartum, I just like soaked it up so much more because I knew it was my last. I was already a seasoned mom. So like breastfeeding was easier and things like that. So
yeah, you're just not as worried about the small stuff.
Yeah.
I'm also a physician, so it's so interesting now that I felt more secure. I'm like, oh, she has a runny nose, no big deal. Yeah. But during the pandemic, it's so interesting. It's almost like physicians tend to be the most lax in terms of taking their kids into the doctor, you'll hear. And that was sort of me. But then the pandemic, it's like it erased all of my medical training. I was just like, no, everything is serious. The baby sneezed. Could this be COVID? So this time around, it felt much more like, she got sick. What do you expect? She has toddler brothers who are in preschool. This is going to happen. And that has been really, I think, also helpful and corrective from the hypervigilance, frankly, that I felt. Yeah. Now I have hypervigilance for other issues, especially living in America today as a mother. Yeah. But certainly the health risks feel less acute.
Mm-hmm. All right. Well, thanks for sharing those stories with us. You want to talk about the resources that you recommend to people?
Yeah, absolutely. So, I think every transition to motherhood and fatherhood is very challenging. And at Mavita Health, we have clinical care in California, New York, New Jersey, and Texas. That's all in network. So it's covered by your insurance. That's really important. But we also know that people live outside of those 4 states. And so we've created evidence-based content that's all on our app, as well as chat groups that are moderated by experts that you have access to for free across the country. So anyone can download the Mavita app. It's mavitahealth.com. You can get it at Apple Store, Google Store, so it's on Android as well. And you can check out our resources as a foundation of, here are some things that could be helpful. Here are some mental health guides. And ultimately, if you feel like you need more, if you happen to be in the 4 states where we have clinical care, we would be delighted to care for you. But also, if you don't, you can email us and we can try to find a referral for you in the state where you live. But we are excited about expanding. But, everything we post on our social media, I'm at Sarah Oreck, MD, and Mavita is at Mavita, Mavida Health. And we just have some, posts that can be light sometimes, heavy sometimes, evidence-based, that really help anchor you to what you're experiencing. And I think just understanding and naming what it is can sometimes be just the thing you need.
Mm-hmm. Awesome. Well, yeah, we will link to all of those things from the show notes. And I just want to say thanks again for your time today and sharing your stories with us.
Thank you so much. I really appreciate being on.
All right, now I'm going to talk with Jackie from Motif Medical about their awesome wearable pump. Hi, Jackie. Thank you so much for joining me to chat about the Motif breast pump line.
Yes, thank you for having me. I'm excited. We have some exciting things coming.
Awesome. Well, before we get into all of that, will you tell listeners just a little bit about you and what you do at Motif Medical?
Yes. So I am a registered nurse and board certified lactation consultant, and I have the pleasure of being the clinical lactation advisor or clinical lactation specialist with Motif, which just means I get to play around with all the fun breast pumps and tell them all the things that might make the pumps and the products better for breastfeeding families. And I absolutely love it. I also work in private practice, so I still and very much, boots on the ground, helping families in their own homes right after birth or anytime in the postpartum period and the prenatal period, just helping families be more prepared for a breastfeeding journey and all the things that they might encounter.
Very cool. Well, I was lucky enough to get to use the Luna breast pump when it was pretty new. I guess 6 years ago now. My youngest just turned 6. And I talk about all the time how it was my favorite pump of all the ones I had tried over 3 kids and everything. And then you guys came out with the hands-free pump a couple years ago. And now there's something new on the horizon. So I want to talk about the new pump that's coming out this year.
Yes, we are very excited. Just after the first of the year, we are launching the Aura Glow, which is a new wearable pump. You might remember the Aura as our original wearable pump, and it's still available, but we've got a new player on deck that I think is going to provide a lot of really sought after features, a lot of great pump quality, and something that moms I think are going to be really excited to use on a pretty regular basis as they're going back to work or just going about their lives where they need to be hands free, need to have that wearable pump option.
Very cool. So I know you guys kind of take a lot of, I don't know, advice isn't the right word, but you take feedback. There we go. You take feedback from customers and what people are liking about pumps and things like that. So what are some of the differences with the Aura Glow that we can expect to see?
Yes, love this question because this is why I love working with Motif, that
Yeah.
they are so particular about taking feedback from the professional community, from the families who are using their products, and they're not just looking to pump out products that, sell. Obviously, it's a business. We need to sell things to stay in business, but the idea is to make products that actually meet needs and make pumping easier for people so that they naturally just want to buy the products, which I love that idea. And I love that we've built the Aura Glow based on feedback. So the thing I'm most excited about is the expanded flange sizing. So you get 5 flange sizes right in the box. So you get the 24 millimeter brush shield, but we also include 15 millimeter, 17 millimeter, 19 millimeter, and 21 millimeter inserts so that right out of the box, most people are going to be able to find something that allows them to pump efficiently, effectively, and comfortably. And then if those sizes don't work, the 15 through 24 that come in the box don't work, we also have even smaller sizes, 11, 12, 13, and 14 millimeter inserts available, and then a 27 millimeter brush shield available for those that might need a larger size. So excited about that. The other things that I think set this pump apart, it's a powerful wearable. So the suction is 260 to 280 mmHg. So that's millimeters of mercury. That's how we measure that suction pressure. And that puts it on par with the suction of pumps like Luna. It's still a wearable, still something that we're going to classify as a secondary pump that we would use to complement the Luna, but it's powerful. And it has 2 pre-programmed pumping modes, which are just, I think, something that's going to make life so much easier and take a lot of the guesswork out of, what settings do I use? How do I set my pump to get the most out of it?
Yeah, the different sizing is huge. I know I tried a wearable pump with my last baby, and it was very early on in the making of these, but that did not work for me and was not comfortable. So having those different sizes is amazing. And do you guys provide some kind of guidance in the packaging, or can people reach out to help find the right size?
We do provide guidance in the packaging that's all been updated to
Mm.
match the most current information we have about flange sizing. So, as I said, Motif is huge on listening to that feedback, and lactation consultants have been screaming about flange sizing for a while now, and Motif definitely has listened by including those smaller sizes and that flange sizing guidance that does fit the most current information that we have about getting the right size.
Amazing. So you also mentioned the programming modes for pumping. Can you explain a little bit about those and what's different with the Oreck Glow?
Yes, so I think this is revolutionary. I love this idea. There are 2 pre-programmed pumping sessions. There is the cluster feeding mode and the general pumping mode. And you can still use the pump, just as you normally would use a breast pump. But the cluster feeding mode has these 5 levels of pumping and then pause, pumping and pause to mimic how a baby cluster feeds. So that can help increase milk supply. And without the need to do this like big, long power pumping, hour-long power pumping session. It's this 30-minute pre-programmed session that your pump will move through all by itself. And then the general pumping mode is just a way to maximize your pumping efforts a little bit by triggering a couple of letdowns. So it goes through massage mode and it stays there for 2 minutes to help trigger that letdown. Then it goes to expression mode and you get that, longer, more rhythmic, kind of mimicking how the baby suckles once your milk has let down. And then it will go back to the massage mode automatically to trigger that second letdown and then go back to expression. So it repeats the massage, expression, without you even having to think about it. And that way you can get a little bit more out of the time you're spending pumping.
Yeah, that's amazing. I don't think I've heard of that before on a pump. And I'm just like sitting here, like picturing a nursing session with baby and like they kind of fall asleep and then they're like, oh, wait, I want some more. And they wake up and then you have another letdown. And I could see that being something that you would really benefit from as far as milk supply with a pump that could do that as well.
Yes, exactly. Just trying to take advantage of all those hormone fluctuations and all the ways that our babies know exactly how to influence our milk supply. We're just trying to mimic that with the pump setting.
Awesome. Okay. So then you mentioned that, you do classify it as a secondary pump. What kind of guidance would you give people that are trying to decide, what pump is right for them, based on whether they're pumping full time or using it occasionally or, lifestyle, things like that? Do you, especially in your work in private practice, I'm sure you see a lot of people wondering what they should get.
Oh, yes. I get this question a lot. And the truth is, when we do anything other than traditional flanges and that high quality double electric pump, like the Motif Luna, anything that doesn't have those traditional flanges and that powerful motor is really considered a secondary pump. Now, does that mean it's not going to work or it's not going to be effective? It's not going to have its place? Of course not. We know lots of people are using wearable and portable pumps, and many of them are very successful at building and maintaining milk supply. But for most people, we want to rely on something that's a primary pump like the Luna to build and maintain a milk supply, and then use something like a wearable or portable pump, so a wearable like the Oreck Glow, as that secondary option that we're using when we just can't drag out the big pump and the traditional flanges. So I have 4 kids. I could very easily see myself needing a wearable pump to be able to keep up with my other children if I were to have another baby, and that would be a perfect scenario to use this pump at those times when you just need to be hands-free. Maybe you're traveling, maybe you're at work, lots of different scenarios. And what I tell people is, if you're in a situation where you can't pull out that primary pump, then this would be a perfect option. A wearable like the Oreck Glow would be a perfect option to complement for those times when you can't pull out your primary pump. And I do have lots of patients who kind of incorporate them from the beginning when they first introduce pumping. We tend to get a better result than if we only use one type of pump and then try to add another pump later. Sometimes it's about getting your body to be sort of conditioned to respond. So maybe adding in that wearable, if you know you're going to need it, adding it in when you first start introducing pumping into your journey.
Oh, yeah, that's interesting. Yeah, I could see it being something that, keeps people nursing their baby just because they may not have pumped otherwise. Like you were saying, you get into a situation where you can't pull out that pump. So you just push off that pumping session, which I know I did with my second baby at work. And then my milk supply suffered. But maybe if I had had something like this, I would have been like, oh, let me just do this real quick while I finish this work or whatever. And I always tell people, block it on your calendar. Like, don't make exceptions. Don't miss a pumping session. But of course, things come up and it can be hard sometimes. So I love that there's just more options out there.
Yes, some milk removal is always better than no milk removal. So it's like, if we can only pump with the wearable, then by golly, let's get that wearable out. That's exactly what we need to do in that scenario. So yeah, I love that encouragement that it might make things actually make that breastfeeding journey go a little bit further with the help of the tools that we have now.
Yeah, definitely. Well, I've loved everything that Motif has come out with. So I'm so excited for this new launch and to hear everyone's feedback from it. And I really appreciate you taking time to chat with me today about the new Oreck Glow.
Yes, thank you so much for giving us the opportunity.
Thank you so much again to Sarah for sharing her stories with us and to Motif Medical for sponsoring this episode. If you want more information from today's episode, head over to thebirthhour.com and search for Sarah's name in the search bar to find her show notes page. And go over to motifmedical.com/birthhour to check out their great offerings of pumps and accessories and maternity compression garments. Really, it's expanded so much over the years. They have a lot of great things there, and you can get them covered by insurance as well. Thanks so much for listening. If you enjoyed today's show, head to thebirthhour.com and click Become a Member to pledge your support. And as a thank you, you'll get an invitation to join our private Facebook group and access to exclusive episodes. Your vote of confidence and support means the world to me.